Hello, this is Dr. Sri Nagesh from Ojas Aesthetic, Madhapur, Hyderabad. Today, as a lipedema specialist, I would like to discuss a little bit about lipedema surgery and before surgery, what to expect and know what you need to do before the lipedema surgery and know what to expect and know how to face it confidently. Now, the pre-surgery anxiety can be quite challenging for many patients, people, and because for some of them, it is the first time that they'll be undergoing any surgical procedure, and so that itself induces a lot of stress. So, once you understand what you are going to go through, maybe that anxiety comes down, and you feel more comfortable, and you'll be more prepared for the liposuction and the lipedema surgery, and be uh, more cool and composed, and face it bravely. So first thing is, you need to educate yourself. The knowledge about lipedema is very, very essential. So, and some details about the surgical procedure. So, you understand what the surgical procedure does, how it is done, you know, what what you have to go through, and know what kind of risks are there, and know what kind of recovery time is necessary, and what post-operative care you need to take, so that once you know all these things, then and you can you can overcome each of them more easily. So, and all those fears will disappear. So one of the most important thing right now, once you know that you have lipedema and you are going for the procedure, is communicate with your healthcare team. Feel free to contact, starting from the receptionist to the doctors, to the nurses, and to the other any other healthcare personnel about the procedure. So you have a clear, honest communication with them. So discuss any questions that you have, any doubts that you have. You just talk to them very clearly about the details about the procedure. Sometimes we need to do it under general anesthesia. Some people prefer general anesthesia, some people prefer regional anesthesia, some prefer local anesthesia. And we can do it either way depending on the area that is to be addressed. And of course, will also try to ensure that we give you some amount of sedation, and so that you are calm and composed during the procedure, so that the process goes through smoothly. In this, what we do is, if you are going under, whether you are going under general anesthesia or regional anesthesia or local anesthesia with sedation, what we do is we inject sufficient amount of fluids into the area, the liposuction area. Once we inject sufficient amount of fluids into the liposuction area, which contains a vasoconstrictor and some anesthetic agent, and sufficient amount of saline, and maybe some amount of soda bicarb, so that the pain factor irritation reduces, then uh, the anesthetist takes control of your breathing, your heart rate, and everything, and the any discomfort or any pain that you may encounter, those things are all taken care of by the anesthetist. We have got an excellent team here, anesthetist, who takes care of all these things. So during the process, the excess amount of fat under the skin and between the muscle is carefully removed while trying to protect the lymphatic system and the venous system. So the surgeon must know his or her vascular anatomy and the lymphatic anatomy very well, along with the general gross anatomy of the limb. And then, uh, with a few small punctures here and there, we start taking off the excess amount of fat, from that particular region, and then go to the next region, and then the next, and then we complete the process. So once the entire process is over, the excess amount of fluid is drained out. Of course, there will be still some amount of fluid that is going to be there, which will ooze out of the small incision ports. Uh, in the next 1 to 3 days, and then you need to wear tight compression garments for a period of a few weeks during a recovery phase, because after this, during the recovery process, there will be some amount of swelling, and then there will be some induration, and then afterwards, as the induration starts to go, the limb starts to shrink and normalize. During this phase, sometimes because of the edema fluid, there could be some amount of heaviness, and if there is a, if you are in a later stage of lipedema, then there could be excess amount of lymphatic fluid that oozes out, and sometimes there can be a little bit of a lymphangitis, for which you may have to take antibiotics for a little extended period of time, and maybe some amount of analgesics and anti-inflammatory agents. So other than that, you can always approach the surgical team, the clinic, and who will be very happy to help you to overcome all these things. And you should also be in touch with your physiotherapist, who is reasonably well versed with lymphatic massages, who has a lymphatic pump and can put you in the lymphatic pump. Do some amount of lymphatic drainages, manual lymphatic drainages. You wear your compression garments regularly, so that also helps you in controlling the swelling, edema, and also helps in the drainage of the lymphatic system, and of course the lymphatic pump. Now, you need to at the same time learn to practice some amount of relaxation techniques, because sometimes the mind plays a little behaves a little naughty sometimes. It tends to pull down your morale, so you have to learn to keep your boost your morale, try to keep yourself healthy, fit, and cheerful all the time, so that you tend to, and try to get into your daily routine as soon as possible. Try to do some amount of meditation, and some other relaxation techniques, like a little bit of yoga, or start exercises as soon as you can. And the earlier you start the exercises, the better for you, because in the exercise also helps in venous drainage and lymphatic drainage, and thereby faster recovery. And also, when there's improved circulation, good oxygenated blood comes to the area with a good amount of nutrition, and this also helps in wound healing. So, adequate oxygenation of the blood is possible when you do good exercises, and have good breathing techniques, and of course a good relaxation. So, engage in activities that promote your healthy physical and emotional well-being. Eat healthy, and maximum amount of anti-inflammatory foods. Avoid high sugars, aerated drinks, alcohols, smoking, tobacco in any form, and of course have sufficient amount of proteins and good fats, so that your body heals well and recovers faster. So sufficient amount of vitamins and minerals are very, very essential in improving your condition. So these are all things, and along with this, you must have adequate sleep and reasonably good physical exercise. So these are all some of the most important things that you need to understand, and make sure that you don't stay as a loner. Try to mingle with people in your community, and keep in touch with your healthcare center, so that they understand your emotions, and bring you up, and you can go through the process in a more easy manner and with more confidence. Thank you. If you have any questions, doubts, then you're always free to get in touch with the clinic at Hyderabad, Ojas Aesthetic, or You can get in touch with us at online at www.ojasaesthetic.com or www.lipedema.in. Then and raise your queries. So we'll be happy to answer your questions.